Okay, good day everyone. So our topic for today is about principles of health education. So health education is defined as any educational activity that aims to achieve a health-related goal. This is the definition given by the WHO. Okay, so any activity can be directed at individuals, group, or even populations with the aim of achieving a health-related goal. First, let's remember this three domains of learning. No? So you have the cognitive, affective, and behavioral. Cognitive relates to factual knowledge. No? Affective deals with emotions, feelings, and beliefs. No? While behavioral would be skills development, or example, skills required to effectively floss teeth or brush teeth. So these are again the domains of learning: cognitive, affective, and behavioral. So we have to understand that human beings are not purely rational in their thoughts, feelings, and actions. Examples would be smokers are fully aware that smoking is a major risk factor for lung cancer. However, even if people know this, no, and this does not stop them from smoking. So knowing does not translate to change in behavior. It doesn't mean that you know that one thing is good for you. Sometimes people would actually not do that, even if they know that it is good for you or bad for you. So when knowledge conflicts with behavior, it is known as cognitive dissonance. So many smokers believe the habit is dirty and socially unattractive, but such attitude will not stop people from smoking. And if you can see the warning, no, government warning in packaging of tobaccos or cigarettes, it says their government warning, smoking kills. It's already there, no? And smoking causes cancer. It's already there on the packaging, but still people would buy that. So that conflict with knowledge, we call that cognitive dissonance. So when knowledge conflicts with behavior, it's again cognitive dissonance. So okay, so cognitive dissonance theory is was developed by Leon Festinger. Okay, so it's inconsistency between thoughts and actions lead to discomfort or dissonance, which moderates changes in thoughts or behavior. So again, the mental conflict occurs when beliefs or assumptions are contradicted by new information. We call it cognitive dissonance. So sometimes when people would have this conflict, they will either reject, explain away, or avoid the new information. For example, if tell them this is the new information regarding this matter, and they're used to that, they will try to avoid that information or persuade themselves that no conflict really exists, no? Reconcile the differences or resort to any other defensive means of preserving stability or order in their conception of the world and of themselves. So for us, the members of the dental community, when we have our oral health preventive messages for our health education materials, should following should be contained, like reduction in consumption of too much sugar, and brushing of the teeth, using a small red brush and change when the breeze is you're worn. So those are the messages that we try to include in our health education materials. Then use of fluoride, do not rinse after brushing. Okay, so normally most people are used to rinsing, but we are advocating that people should not rinse after brushing because it lessens the effect of fluoride. And of course, you visit the dentist regularly. Of course, smoking also, we have this commit to quit. It is being supported by dentists worldwide. This is from the WHO. drink alcohol in moderation and be aware of your units of consumption. Because as we all know, smoking relates to a lot of diseases. Okay, but that would be a separate topic for us. So when implementing preventive messages, we can advise. No, our advice requires patients to change their behavior in line with professional guidance. This can be termed patient adherence. It's defined as the extent to which a person's behavior, taking medication, let's say following diet, and or executing lifestyle changes, corresponds with agreed recommendations from healthcare providers. So normally when we advise our patient, they just say yes, they're doing that, they're doing this, or they will do that. But in reality, most of the time they won't. Based on, because of, again, as we have mentioned, cognitive dissonance theory. So we have to understand the patient and their needs. We cannot tailor the advice and support to our patients. Different patients would have different needs. And when we are communicating with our patients, we should also listen. Why do you do this? Well, why you do not do this? So use of open questions and encouraging tone will all help patients reflect and explore their experiences. Review benefit of changing in past experiences. So for example, your patient has experienced difficulty in breathing in the past, and then when they stop smoking, their breathing improved. So again, you review the benefit of changing in past experiences. Learning from past experiences can again help to increase people's self-confidence and insight. So for our health education, ideally, we should use the SMART, specific, measurable, achievable, relevant, and time-bound. So specific, clear, and precise goals should provide focus and clarity of purpose. Measurable, meaning setting goals that can be easily measured and quantified as important. Achievable, set goals that are challenging but within the patient's reach. Okay, so for example, your patient is addicted to too much sugar. So let's say your patient drinks a lot of soft drinks and milk tea. We all know that they contain too much sugar. We can advise them to reduce. So for example, they're taking this size, let's say large. The goal is the patient would consume at least a small amount of that. Relevant and timely. Relevant is essential when it is considered relevant to the patient's circumstances, motivations, and needs. And timely is important to check that the goal is the right thing for the patient to achieve right now. So setting a clear time frame is also important to help maintain motivation and to monitor progress. So for example, quitting smoking, better if it's time bound. So what the profession's advice is to make a target date for them to quit. Like for example, on my next birthday, I will quit. That's time. So plan ahead for success. What's also been agreed is when possible to develop an individualized action plan mapping out the factors needed to achieve the goals agreed. And identifying suitable and appropriate rewards for any progress achieved is an important part of the planning process and helps maintain motivation. Monitor and review patients' experience of changing their behavior, usually every 6 months. And the same with us for dentists. When you see a patient with poor oral hygiene, and then you did your scaling and polishing for that patient, it does not end there. We have to advise the patient to come back after 6 months. Most often than not, patients would actually not come back after 6 months. Some of them would actually come back after 6 years. Okay, when there's pain again. Okay, so but we should not give up. We should always remind our patients. Good opportunity to assess and review progress. And sometimes it's better to refer also if they need a specialized management. For example, we always advise our patient when we have our scaling that they should not smoke or at least lessen, and because of the stains that we see on their teeth when we do scaling. Okay, but of course, if the patient is willing only, if the patient is willing, we can refer the patient to smoking cessation centers. so they can have professional support. Oral health education methods could be one patient, one dentist, like that, or group of students, group of health workers, group of employees, okay, so and others. Now we can use social media if you really want, mass media, print, posters, pamphlets, flyers, we can give to our patients. Education materials could be an app, computer programs, information pictures, whiteboards, leaflets, and anything. Be creative in doing our health education materials. Okay, these are examples of posters that we see in dental clinics, and also these posters were placed in strategic places like markets, LRT stations, train station, to remind people that the importance of oral health. How do we know if health education materials are okay? Of course, there should be no conflict of interest. For example, one company is sponsoring uh, this idea, no, but that would be in conflict with our profession. Okay, so we should avoid that. Process of development, indication of collaborative working. So I mean, the more collaborative, it's better not to always include other stakeholders in a health education campaign. Objectives implied or stated. Uh, are our health education materials appealing, visually appealing, stimulating or engaging? Because if not, people will probably not even read those. May equal opportunities, consideration given to population diversity, understandability. Do not use too much technical terms when creating health education materials, and practical focus, meaning of the application and how they will affect our patients or the community. Team approach of prevention, dentist, the leader of the team, as always. But the dentist can be supported by dental auxiliaries, like dental assistants, dental hygienists, even dental technicians. For our health education, the following are important: communication skills, appropriate questioning, active listening, summarizing information, giving feedback, and assessing needs. Also motivational interviewing, presentation skills, goal setting, teaching skills, and working with small groups. So we do this, for example, in our community, we also educate our adapted communities, not just provide treatment, but also educate them. So what are the settings for our health education? Could be primary care, health clinics, schools, colleges, or maybe we can practice educating our barangay, for example, like that, daycare centers, or elementary schools, local authority services, and other settings. Workplace, commercial organizations, communities, older people, residential homes. Or in our case, could be like bahay ampunan, we call that bahay ampunan orphanage, and other group of people. So those are the settings for health education. Actually, anything can be a setting for health education. Potential partners, we could have a general practitioner, dentist, teachers, school principal, local politicians, local leaders, and other people interested in health education. And others, potential partners. Actually, anyone can become your potential partners. So in summary, oral health education is an important part of oral health promotion. And planning and teamwork are needed to effectively provide oral health education messages. And health education should be evidence-based. So meaning everything that we put on our health education material should be based on current scientific literature. Okay. So thank you very much. This is our reference for this topic. Thank you very much again and have a good day.